Good morning and welcome to Reef in Focus. I'm your host today, Eleanor Gregory. In today's webinar, we're going to be taking a deep dive into reef health and looking particularly at one of the key measures of reef health, which is coral cover. Before we start though, I would like to acknowledge the traditional owners on whose lands we are presenting this webinar from today, the Beeden and Woolgooroogabar people. I'd like to pay our respects to their elders past, present and emerging. I'd also like to acknowledge all the traditional owners on whose land and sea country this great area that we call the Great Barrier Reef exists on. We'd also like to acknowledge their management of this iconic wonder for thousands of years. Now, joining me in the studio today, I have our Assistant Director of Reef Health, Dr. Jess Stella. So welcome, Jess, and thanks for joining us today.
Thanks for having me, Eleanor.
And we also have our Assistant Director of Synthesis and Reporting, Paul Grove. So welcome, Paul.
Thanks, El.
Thank you for being here. We'll also be joined by the Australian Institute of Marine Sciences Senior Research Scientist, Dr. Mike Emslie, and the Reef Authority's Acting Chief Scientist, Dr. Roger Beeden. So that's our panel for today, and it's going to be a really great opportunity for people to be able to ask questions of our panelists and to find out more about reef health and coral cover itself. Now, just a bit of housekeeping before we start off. We'd really love to get those questions from you coming in so that the panelists can answer them. You'll notice that we have the Q&A section set up for that. So if you've got any questions, please just pop them in there. We have the chat function disabled. It's just to take away any more distractions. And so we can actually see your questions when they come through the Q&A. So any questions, please pop them in the Q&A function and we will get to them if we can during the webinar itself. Or we've also set a few minutes aside towards the end where we're going to have a panel Q&A discussion section. So if we don't get to your questions as we go along, we'll certainly try and make sure we cover them off at that point. Now, we do have a very full half an hour, so we'll kick off now. For those of you who are unfamiliar with the Reef Authority, we are the lead management agency for the Great Barrier Reef. In a nutshell, this means that it's our job to manage and protect this amazing World Heritage icon, both now and into the future. And as most of you will be aware, the reef has been undergoing a period of rapid change over recent years against a backdrop of a warming climate. To this end, it is actually critical that we monitor, measure, and understand what's going on out there on the reef. So this really brings us to what we want to be talking about today. So Jess, I think we'll kick off with you with the first question, and it's a pretty broad one. At the Reef Authority, we do talk a lot about reef health. Can you give the audience an idea and understanding of what actually makes a reef healthy and how can we tell if a reef is healthy?
Sure. So coral reefs are usually dominated by corals. Knowing that we have a broad diversity of species and a large abundance of corals is one way that we keep track of whether the reef is healthy or not. The reef's not all about coral, though. On the Great Barrier Reef, we have over 15,000 different animal species, and less than 5% of those are the hard corals that actually provide the habitat. So there's an abundance of fish species as well as invertebrate species, and knowing that we have that diversity and abundance is also another way that we know that the reef is healthy.
So I guess the flip side of that is an unhealthy reef. And your team is focused on monitoring reef health, particularly during those really stressful hot summer months. Can you just explain what causes a reef to be unhealthy?
Sure. So during the summer, it is a particularly challenging environment for corals. We are more prone to cyclones, to mass bleaching events caused by thermal stress. So when the water temperatures reach beyond what corals usually cope with, they stress out, and it's a very visible kind of illness where they appear bleached. So they start to lose the symbiotic algal cells that they have in their tissue, and that symbiotic relationship really helps corals survive. So it provides up to 90% of their food. Once those symbiotic algae leave the coral tissue, it starts to look paler and paler, and that's what we call coral bleaching. So it's a really visible sign that the coral is stressed and the water temperature is too high. Other things that we can look at to see if the reef is healthy is the levels of coral disease. So corals have an immune system just like humans, and they are prone to diseases as well, just like us. They can recover too. Another is the crown of thorns starfish. So it's a native species, but when it occurs in outbreak proportions, it can devastate large areas of coral reef. So all of those things are what we're monitoring during the summer months and throughout the year, really, but during the summer is a particularly challenging time.
So from what you've told us, coral is a really good indicator, or it's one of the really good indicators of what's going on. And given that we are seeing these intensely hot summers and we are seeing warming in general, what sort of impact do you see happening more often with that?
So we've had 4 mass bleaching events since 2016. And 2016 was a global mass bleaching event, so that affected coral reefs right around the world. Given that we have warming oceans, that leads to a higher chance of extreme temperatures happening in the waters. So corals are locally adapted to their normal temperature. So it's usually cooler in the southern Great Barrier Reef, warmer in the northern Great Barrier Reef. And they're very well adapted to that narrow range of temperatures, unlike more temperate species that can deal with a broad range of temperatures. So when the ocean warms up even 1 degree, 1 degree Celsius, that is, for a period of time, that can cause coral bleaching. The more that we see these disturbances happen with the less time in between to recover, the more degraded or unhealthy the system can be. So it's not just about what happens in a single year, it's kind of what happens over a series of years and what happens in between. So getting those recovery windows really important for coral reef health.
Now, Paul, you're also really heavily in monitoring and reporting on reef health, or on the state of the reef and reef health. So what are some of the ways that we can actually measure what's going on out there in the marine park?
Yeah, thanks. Just like in human health now, if someone gets sick and you have the flu, you've got people such like a nurse can take your temperature and get an indication of what's going on. The same, you might have an X-ray technician. We use an X-ray machine to determine that you've got broken limbs. With the reef, it's the same sort of thing, but we're trying to cover a big ecosystem and a wide range of species, ranging from the biggest of whales down to the corals that make up a lot of the habitat, right down to the little tiny crabs that live within the corals. And to do that, we just use a range of technology and people. So we have satellites in space that give us a snapshot of the big picture. We also use aircraft to sort of go in and get that next level down sort of imagery. And then from there, we can even use drones. In some cases, we'll fly drones to sort of get an understanding with things like islands. But then also just sort of people on the ground, people that are looking out. And quite often, that information comes into our Eye on the Reef program. But most of that sort of stuff's above water. Most of the reef's actually beneath the water. So to really get a handle on what's going on down under, we've got to jump in wetsuits, get in there and go to the bottom. On top of that, now we're starting to sort of capture cultural information. So our traditional owners have been managing the land for millennia. So they're providing information to us as well. And then it's my role is to get all that information, make sense and give you an answer as to whether the reef is healthy or not.
And I guess it's really tough having to chuck on the wetsuit, dive in and just do it for work purposes, of course.
Absolutely. Terrible job.
Yeah. So just to put it in a bit of context here, when we're talking about monitoring the reef itself, we're actually talking about a massive area. The reef itself spans about more than 2,300 kilometres along the Queensland coast. It's bigger than Italy. And for footy fans out there, it's roughly the same size as 70 million footy fields. So that's not 17, it's 70 million footy fields. So it is a huge area. And I guess the big question then is, how do we actually keep an eye on what's happening with an ecosystem that's that big?
Yeah, absolutely. And in that mix, there's 3,000 plus individual reefs, and there's over 1,000 islands stretched out over that area. So it's a big job. And I don't get out of the office much, so I don't get to go and have a look at all of them, unfortunately. But there are other people who do. There's people that get out there. There's people who are out there recreationally. They can report stuff through the Eye on the Reef. We've got fishers out there that, whenever the weather's nice, they're out there. We've got commercial fishers that perhaps are there all the time. And the same, we've got the tourism industry. They're out there daily. They're visiting that same site, so they get us different sort of information. And then we've got our highly trained master reef guides that just, live under the water and just bring us fantastic information.
So it's not just down to us at the Reef Authority to be collecting all of this. And we're also working very closely with our partners in the science field as well.
Yeah. So we've got the universities. So a lot of the universities do research out there, and they're helping us to try and sort of understand what's sort of going on within the reef space. We've got field management program, which is the park rangers, so the boats are out at sea all the time, and while they're out, making sure people are doing the right thing, they can also collect information for us. We have the marine monitoring program, which is looks at things like seagrass and our inshore reefs and our water quality. And then we have the Australian Institute of Marine Science long-term monitoring program, which sort of does a lot of the mid and outer shelf reefs. That's looking at things like coral cover, and also sort of captures other information such as fish diversity, particularly with things like herbivorous fish.
So it really is just bringing all of those factors together, all the information, all the different elements of the ecosystem and monitoring it all to build up that really big picture. And I think we do have a question that has come through. So I'm not sure, Paul or Jess, or I'm going to throw this one too, so please jump in. And the question is, how much damage does raw sewage do to the reef?
Oh, look, I'm happy to take that one on.
Yeah.
So most of the sewage plants up and down the Great Barrier Reef are actually at tertiary level standards, so that the water that's being discharged for them, and in some cases it's being used to irrigate back on land, some cases it's going into our waterways now. So the water quality is actually really good with them. On the other hand, we've got a few locations where we've still got septic systems in there, but the nutrients and stuff tend to sort of leach out slowly. So the impact is not that sort of great, not from the land side. With the marine side on vessels, we have regulations in place that control the discharge of sewage.
Yeah. And water quality is obviously a really key issue when it comes to looking at the health of the reef. Yeah,
very much so.
Well, thank you, Paul, because you actually happened to mention something that I would like to be able to draw on now, and that's to introduce our very next panelist. It's Dr. Mike Emslie from the Australian Institute of Marine Science, otherwise known as AIMS, and I think I'm going to refer to it as AIMS from now on because it's much easier to say. So, Mike, thank you so much for joining us today.
Pleasure to be here, Eleanor. Thanks for having me along, and good morning to everyone online.
Now, this is the perfect time for you to come in because we're talking about coral cover as one of the key measures of what's going on out on the reef. And you actually lead AIMS's long-term monitoring program. So are you able just to tell our audience what this is and what coral cover tells us over time about the state of the reef?
Sure, absolutely, El. So the AIMS long-term monitoring program is the longest running, most spatially extensive monitoring program of the Great Barrier Reef. It's been underway since the mid-1980s. We use a number of different techniques to assess the status and the health of reefs right across the span of the Great Barrier Reef. We do very detailed surveys on fixed sites at about 70 odd reefs. And here we're looking at the diversity and abundance of coral and fish assemblages. We want to know about the potential for recovery following disturbances. So we measure the amount of juvenile corals, which are corals that are about 5 centimetres or less. That'll give us an indication of how things are faring into the future in terms of recovery. And we're also looking for things that kill corals. So we're talking about crown of thorns, starfish, the amount of corals that's bleached, coral diseases, and physical damage from waves and storms. We measure a lot of different metrics of reef health, but one of the most robust and widely used ones and relatively simple is percent hard coral cover. And this is simply, you can think of it as the amount of the reef surface that's covered in living corals. It's as I said, well used and widely used among the scientific community, but it doesn't tell us everything. It doesn't tell us about the diversity of corals. It doesn't tell us about the makeup, the reproductive capacity and all those type of things. But it does give us a really good indication of the status of or the amount of the ecosystem engineers, which are the living hard coral species.
So the last report from the long-term monitoring program, which was released last year, showed that we're in something of a recovery phase on the reef at the moment. It found that coral cover is the highest that it's been in some time on parts of the reef. Can you just take us through what you're actually seeing out there and what this means when we're discussing reef health?
Yeah, absolutely, Eleanor. So as I mentioned, the monitoring program's been running for 37 years, and it's given us a really good insight into the dynamics of the coral communities out there. What we've seen is that coral cover does fluctuate up and down in response to disturbances that we've mentioned before, such as bleaching and COTS and cyclones. But they can also recover from these events. The period from about 2011 through to say 2022 was one of intense cumulative disturbances. We had the beginnings of the fourth wave of crown of thorns starfish outbreaks. We had numerous severe tropical cyclones, and then we also had 4 mass coral bleaching events in 7 years. And it really drove coral cover down to fairly low levels just after the 16-17 bleaching. But since then, we've had pretty much a hiatus in events, widespread events that have caused coral death. And what we've actually seen is that we've seen the reef recover. Coral cover has increased very strongly in the northern and central Great Barrier Reef, and to the highest points that we've seen since we've been monitoring over 37 years. So some really good news there, and it really does show that the Great Barrier Reef has that intrinsic ability to recover if it gets a chance and gets a break from disturbances.
So that brings me to one of those questions that we do get asked at the moment, and that's the question of looking at this concept of the recovery phase. We're talking about a recovery phase, yet only last year, summer of 21-22, we were actually reporting a mass bleaching event. So how is it that we can have a mass bleaching event at the same time that we're talking about a recovery phase? How does that work?
Yeah, it's a really good question, Eleanor. And basically the short answer is that not all bleaching events are created equal. So the 2016-2017 events were really severe. They had really large amounts of heat stress accumulation over a long protracted time. And not only did this cause widespread coral bleaching, but it also caused a lot of the corals to die. The 2022 and 2020 events weren't quite as severe. The level of accumulation of that heat stress was nowhere near the levels that we saw in 2016, 2017. It was to the level where we did see fairly widespread bleaching, but not quite to the levels where we saw widespread mortality. So despite the fact that we had the bleaching events in 2020 and 2022, we've actually had a reprieve from events that caused corals to die. There were no other severe tropical cyclones that occurred during that period. The number of outbreaks of crown of thorns starfish have diminished. And this has really given the reef a bit of a hiatus from, coral killing events, and allowed these fast growing and proper colonies to really expand and grow quite quickly. And that's what's driven the recovery that we've seen.
Well, that ties in really well with the question that we've had come through, which is how long does it take coral to grow?
Well, different types of corals will grow at various rates. So the fast growing stuff that we're talking about, you can see in the picture behind me, grows really quite quickly. We're talking sort of 2 to 7 centimeters a year in some cases. But then the really large Porites bommies, the classic big, massive corals that are often referred to as old growth, are exactly that. They grow really, really slowly. It can take hundreds to thousands of years to achieve, the size of a small house or a garage, something like that. So coral growth is quite variable, dependent on the type of coral we're talking about.
I guess one of the things that I'd like to ask, obviously, is that with this recovery phase as you've been talking about, is there any concern that this is being driven by those fast-growing branching corals, the ones that are fairly susceptible to thermal stress and to storms, and are actually a preferred food of choice for the coral-eating crown of thorns starfish? Is this a worry?
It's not really a worry. I think that these table and branching cropper that have really mainly driven the recovery we've seen in the last few years are actually the predominant coral across a large portion of the Great Barrier Reef. And they're really responsible for a lot of the dynamics that we see. as you mentioned, you know, they are very susceptible to those three major types of disturbances. So they will be the ones that that go after those disturbances. But as we've seen in the last couple of years, you know, they're also responsible for really fast growth as well. So a bit of a double-edged sword, you know, they're fast to grow, but they're also first to go. So, you know, not concerning. It's what's been responsible for driving the dynamics of coral cover on the Great Barrier Reef probably for millennia.
Now, I can see there are a few questions that are coming through, but Mike, we will let you pop off the screen now. Please don't go away. We certainly want you to come back and join the panel discussion in a few minutes. So whatever you do, don't press that red hang up button, and we'll get back to you shortly. We will try and pop those questions in as we're going along chatting to our next panelist. If we don't, we'll bring them up for our panel discussion. So please don't worry if we haven't got to your question just yet. So now it is time to bring in our final panelist. The Reef Authority's Acting Chief Scientist, Dr. Roger Beeden, is joining us now. So thanks, Roger.
Thanks, Eleanor. Good morning to all the panelists and to the people online.
Now, Roger, we've been hearing from Mike about the long-term trends on the reef, and just wondering from your perspective, what does this mean for the future of the Great Barrier Reef?
So thanks for the question. It means all sorts of things. You know, understanding health of the reef at this point in time and what's happened, the trends in time, are really important from a management point of view, because they help us to target our management actions, help us to manage the effect, and also to adjust our management on the basis of what's coming. I think that the other thing that was mentioned is about the resilience of the reef, and that's like human fitness. It's kind of what's likely to happen in the future. We've touched on the recovery dimensions of the reef, so that's how quickly it sort of bounces back from those impacts. But there's also, importantly, our management helps it to tolerate impacts. And so many of the measures like water quality improvement, the zoning plan that we have in place, are really about trying to make sure that it's as healthy as possible, as Jess was talking about, as fit as possible, so that it can meet these challenges, particularly the ones that are coming as a result of a changing climate.
So, Roger, at the Reef Authority, we've been managing the reef effectively for more than 40 years. What does what we're seeing at the moment tell us about our management and our management focus going forwards? And then I do have another question for you after that has popped up on zoning. So if I can get you to tackle the management going forward, and then we'll go on to that one.
Well, we might touch on that and the response. Look, I think that the main thing overall is that we've had 40 years of management. We're very fortunate that Australia has actually invested in the reef so well, and because it's such a loved icon in Australia and around the world. But we shouldn't rest on our laurels. We need to do more, because the challenges of climate change are very real, and they pose a particular significant threat to the Great Barrier Reef through many of the measures through many of the impacts that Jess outlined. So the main thing is that we need to make sure that we are making sure that our existing management arrangements, and there's lots of those, but the zoning plan, the protection arrangements in the park are actually as good as they possibly can to, or adjusted to these changes, but also that the people adhere to them, that they actually do the right thing when they're out on the reef. And then there's additional measures that we're putting in place. So things, and the most obvious ones of those that might be things like the Crown-of-Thorns Starfish Control Program, but then also things like reef restoration initiatives. If I might just touch on the Crown-of-Thorns Starfish Control Program. So I think, as was said earlier on, they're a native animal that exists on the Great Barrier Reef, and they are very, very good, very well adapted to eat coral. They particularly like the sort of branching corals and plating corals that are behind Mike and myself and on the screen in front of you, and they're very well adapted to do that. We're not bothered about them when they're in relatively small densities. That's an important part of reef ecology, but they can boom in their populations to plague-like numbers. And when they do that, they can eat very large areas of coral, but they become a major driver of mortality. And importantly, unlike coral bleaching events that Mike talked about and the major cyclones, Crown-of-Thorns starfish is something that we can tackle. And in fact, as you can see, that's exactly what we do. We have specialist teams of divers that actually inject the starfish. They then die, and we can reduce the amount of coral losses that happen as a result of Crown-of-Thorns starfish predation. And we're seeing the implications of having done that on a widespread scale within the Marine Park Authority and the AIMS data at the moment. So it's certainly protecting the recovery of the reef and making sure that what's there can tolerate future impacts. The other thing I'll just touch on is that we've also got measures in place at the moment, working with the scientific community to look at local scale rehabilitation programs, how you might help reefs to quickly recover that part of resilience after we see impacts like bleaching events or cyclones. And that's particularly important at places like tourism sites that are dotted up and down the reef.
Thank you. Thanks for that, Roger. Now, look, I might actually bring Mike back in and we can kick off our panel discussion because we do have quite a few questions that are piling in at the moment. Might start off, Jess, for you or Mike, could you please clarify how high cover of a few fast-growing coral species translates into recovery of the reef when what we're talking about is the importance of biodiversity?
Well, as we were talking about before with the abundance and diversity of coral, so coral is the defining feature of coral reefs, and the actual coral colony serve as habitat for invertebrate species and fish species, and a lot of those fish species are also target species in the fisheries. So having any type of coral is better than none. So that coral, those fast-growing species, they may not be the most diverse assemblage, but they still provide the really important habitat that we need to support the function of the ecosystem.
So there's another question here, and I guess that sort of covers that off a little bit, which is what does the increase in coral cover tell us about biodiversity on the reef? So does that tie in that if you're getting some coral, we are increasing biodiversity in general?
It depends from a perspective of recovery. If you have a cyclone go through a reef area, it can really scrub the substrate clean and you might not have any coral. So those fast growing species are like the pioneering species. They come in first and they set the scene for a full recovery. So having those acropora species, although they may not be very diverse, they have a big range of growth varieties. So as we see the branching corals and the plate corals behind Mike and Roger, and those really structure the habitat. So they may not be the most diverse, but they are servicing the ecosystem with that really important function of providing habitat to everything else that lives there.
Elena, can I add something to that? Is that okay?
Yeah.
Just to say, I mean, I think the question about biodiversity, as Jess said, it's not just about the diversity of coral species, it's about that those habitats support the biodiversity of all of the other species. They're across many, many different families and groups across the actual reef. So that's why, even though we might see changes in the number of different types of coral species, it's still critically important that it recovers quickly, because that's the home for so much of the broader biodiversity on the reef.
And I'd just like to add that even though we're talking about recovery being driven by acropora, it doesn't mean that they're the only corals that are still there on the reef. There's still a vast array of diverse types of corals that are there. It's just that the really fast growth rate of these acropora corals are the ones that really drive the regional patterns in hard coral cover. So when we say it's driven by acropora, they're the ones that are really behind the major trends that we're seeing, but there's also a very diverse array of corals that are out there, and we're actively undergoing analyses now to look at changes in coral composition, community composition, and hopefully we'll be able to elaborate more on that later in the year.
Thanks, Mike. There is another question that has come in, which is asking, what is the current definition of a mass bleaching event? Are we talking about the whole of the Great Barrier Reef, or sections of the Great Barrier Reef? So who would like to tackle this one?
We are actually coming up with that definition and putting it into very specific terms. So it is a bit of a loose definition. It's been used since the 1960s, but really having no technical scientific definition. What we consider to be mass bleaching is many different species of corals showing signs of bleaching across a large area or widespread area of the reef. So maybe north and central, or the central and the southern part of the reef. It's still defined by about 10 reefs in each of those regions showing signs of bleaching. When we do have mass bleaching, it's usually more than 10 reefs, but it's really just widespread. And I guess given the size of the Great Barrier Reef compared to other reefs, say in the other parts of the world, much, much smaller. So it's kind of relative to the size and the area that we see on the reef.
Now, I'm just noticing that we are almost out of time, but there has been a question that's popped up a couple of times, and that is, what can I do as an individual to help protect the reef? And this is going to have to be a quick fly around because I think everyone has got a lot they can say about this, but we're down to like 0 minutes. So Roger, do you want to kick this one off?
Sure. I mean, look, everybody can reduce their own carbon footprint, greenhouse gas emissions. Do all you can in that space. That's really important for the reef, and do the right thing when you're out on the reef and visiting this amazing wonder.
Okay, Mike.
Yeah, I'll just reiterate those points that Roger made, and especially when you're out on the reef, you know, it's the little things like, you know, adhering to the zoning plan. When you're throwing an anchor out off your boat, make sure you're throwing it on sand, not on the coral, you know, and adhere to the bag limits of fishes, because fishes are very important in terms of ecosystem function, and emerging evidence is showing that they are actually effective in helping control numbers of crown of thorns starfish.
I was going to say, even if you don't get into the water, little actions like on the beach, so picking up plastic and litter off the beach, you know, one piece of plastic can last for a long time in the ecosystem and kill multiple turtles. So each piece of marine debris that you pick up is helping contribute to the health of the broader ecosystem.
And Jess, do you want to wrap this one up?
I would say if you haven't seen the reef, get in there and see the reef. That's really the best way to connect with that, fall in love with it. People protect what they love, so they'll be more protective of the reef for the future.
And I guess that's pretty much, in a very quick nutshell, the message that no one is too small to be making a difference and doing their bit to protect the reef. And I'm so sorry, I've got to apologise to those whose questions that we haven't been able to get to, but it is time to wrap this up. So I'd like to just leave you with pretty much what Jess said, and that is, whether it be virtually or in person, we'd love it if you could see the reef, to fall in love with the reef, and to do what you can in your own lives to help protect the reef. So thanks so much for joining us, and thank you for your fabulous questions. We look forward to seeing you next time. Goodbye.